My YouTube channel Medical Classes by Srinidhi Kumar Acharya. So don't forget to subscribe my channel and also give your valuable comments. So today I am back with another important samskara. Of course, you know that now we are dealing with a series of samskaras. In the first two classes we have seen the basics of samskaras. Later in another class we have seen the clinical correlation and present day significance of Jatakarma samskara. So rightly in this class we will see and elaborately we will analyze another important samskara which is explained in the series of samskaras, that is called as Dola shayaana samskara. So that is called as Dola shayaana samskara. So Dola shayaana samskara, if you see, basically this is not explained in Ayurvedic Samhitas. This is one of the samskara which is explained in the Hindu religious books. There may be many reasons why it is not mentioned in our Samhitas, or Kashyapa would have been mentioned it and it would have been missed, as the Kashyapa Samhita is missed many times in the history. It's very unfortunate that we don't have the complete Kashyapa Samhita with us today. Anyhow, this samskara we find enough references in Hindu religious books. We will call it as Grihya Sutras, and one of that such book, that is Dharma Sindhusara. So that explains this Dola shayaana samskara in detail. Okay, so we shall see now the details of this Dola shayaana samskara. As you know, the word meaning of Dola means it is a cradle. Same is called as Tottilu in Kannada. Same is called as Doli in Hindi, and in English it is called as cradle. So Dola shayaana means sleeping. Okay. So first time baby was put on the dola, or first time a procedure where the first time baby was shifted to the cradle from the mother. Okay, previously child was always kept along with the mother, and now child has been transferred into the cradle. Okay, a small social function will be performed during that time, and that is called as Dola shayaana samskara. Okay. So this samskara is performed when the baby is transferred to the cradle by the mother or the relatives for the first time. The word meaning of cradle is nothing but dola or doli. Now, usually according to Dharma Sindhusara or Hindu religious books, this has to be done on the 12th or 13th day of life. This should be done on the 12th or 13th day of life. So let us see what are the importance of this Dola shayaana samskara. Now this Dola shayaana samskara done on the 12th or 13th day of the life. Now this is nothing but assessment for the development of the child till early neonatal period. Okay, so total neonatal period is divided into two parts. One is early neonatal period and another one is late neonatal period. Early neonatal period starts from the cutting of umbilical cord to first 7 days of the life, and 7 days onwards to 28 days of the life it is called as late neonate. Total this period is of 1 month is called as neonatal period. So this is done usually the 12th or 13th day. So that suggests that this samskara has to be done as a examination procedure or developmental assessment of the baby till the early neonatal period. Okay, the timings little varies. So early neonatal period is 7th day, and here the samskara is done, Dola shayaana samskara is done on the 12th or 13th day. Anyway, there may be 3 or 4 days of gap. That's a different issue, but this can be used as an assessment for the development in the early neonatal period, because early neonatal period is very important period and it is also considered as risky period. Okay, so high risk period it is. Okay, first 2 weeks in the life of the baby is very important, and anyway we will see that detail. This samskara is performed when the baby is transferred to the cradle by the mother for the first time. Okay, usually on the 12th or 13th day of life. Now, traditionally, if you are talking, because this samskara is mentioned in the traditional book only, okay, so not mentioned in Ayurveda Samhitas, therefore we have to first consider its traditional importance and then we will look into the scientific importance. Okay, so traditionally in villages and certain orthodox families, on the same day, that is 12th or 13th day, the first degree relatives of the child will get purified by the Navagraha Homa, Tirthasnana, and also sprinkling of the sanctified water. In the different parts of the country, this is practiced in different ways. If you look into the South Indian tradition, what actually we will call it as a Shuddha. So it's a day of getting Shuddha. In Kannada, we used to say that Shuddha Aitu. Okay, so this is the day all the family members are get purified. All the family members are purified for the first 12 days. So usually we will consider that first 12 days as Ashuddha Kala. Ashuddha Kala it is considered, and that's called as it's called as Ama. Okay, so in local Tulu language, if you see, it is called as Ame. Ame. Okay, Ama means we know that it's impure. Okay, so like that. In different areas of the country, in different parts of the country, it is practiced named in a different way. But one thing is very clear. Usually, in maximum part of the country, on the 12th day, such purification procedure will be done. Either the whole home will be, all the home will be get purified, it will be washed, and the old clothes will be discarded and new clothes will be taken, and child will be also wear with the new cloth after washing, and later the elder members of the family, so they will visit a particular temple and take some tirtha from there, and then they bring it and sprinkle all over the home. And even in the home also, sometimes the Navagraha homas for the purification purpose, it will be done. So whole everything is for the purification. Okay, so to maintain the aseptic condition, that's the main issue. Okay, in these 12 days, the family members are even not allowed to go outside. Okay, it is restricted that family members should not visit any of the function. Yes, first 12 days. Okay, and again, they should not visit the temple. See, again, idea is same. If they visit another function and come back to the home, the chance of infection is more. Okay, they can be the carriers. So for first 12 days, when the high risk period is going on, don't go anywhere, be in the home only. Only on the 12th day, when the high risk period is over, then only go out. If you go to the temple, again there is a chance of bringing infection. If you go to a function, again there is a chance of bringing infection. So idea is very clear. Idea is to maintain the aseptic pressure, aseptic precautions. Okay. So because there is a condition called as a late onset of septicemia, which is very dangerous. Septicemia is called as silent killer of the baby. Okay. So in those days, what actually is such strong antibiotics are not present, and therefore they always used the precautionary method for the prevention of infection. Okay, therefore sometimes it looks like too much of precaution has been taken. Yes, that was needed in those days, because strong antibiotics which can able to combat the infection was not maybe present in those days. They have got their own methods. So what they thought is prevention is better than the cure. Okay, so this is one thing. Okay, the so tirthasthana and sprinkling of the sanctified water will be done all over the body, including the room where the baby will be kept along with the mother. All the rooms and doors of the homes will be washed and new clothes will be used. Yes, the traditionally putting the baby to a cradle is a very important event where the trained old ladies participated. Again, I'm traditionally talking now. Scientific part we will see later. Traditionally, this is an event where only the ladies are involved. There is no role for the gents. Okay, the father has no role in this particular procedure. It's only the procedure of the gents. Okay, so rather ladies. That the old ladies. The ladies will first decorate the cradle. Okay, first they will decorate the cradle and they put some fragrant materials to that, and by flower and all they will decorate the cradle, and while then the baby will be transferred to the cradle for the first time. Okay, in Kannada you used to say that tottilo hakudu. Okay, so in Hindi it is called as doli mein dalna. Okay, so while old ladies were present, they are very important, because see, always a new doctor is a old lady is better than new doctor, because a old lady who has got a practical experience of 5 or 6 deliveries, okay, she is better than a new doctor like us. Okay, so because they have got practical experience of going through that particular situation. So these old ladies, they will give the tips to the mother, especially the prime mother. If she is priming, then they will give the tips how to feed the baby, how to nurse the babies, okay, how to take care of the baby. So these are very important tips. Okay, even nowadays the neonatologist doctors will do that particular job, but in olden days it is the these ladies who are experienced ladies. We know that in olden days, so they used to have 13, 14, 15 kids. So you just imagine how much experience they have got. Okay, the old ladies, how much experience of child rearing they have got. So it's tremendous experience. Okay, so therefore they are the main focus in this procedure. So they will be there and they will be teaching the primary lady to how to take care of the child. So this is a program where ladies will dominate. Okay, so this is traditionally everything I told. Okay, then afterwards a social function will be conducted and some dishes will be prepared, some sweets will be prepared, and everybody will enjoy. Okay, the old ladies will give the tips to the mother, and they will also give the confidence. They will also tell the breastfeeding methods, everything, and the function is over. Now come to another part of this Dola Shayaana Samskara. That is, actually we have got two types of cradles. One is nowadays what we are using is made up of iron. Nowadays we have got fabric, fabric metal, some other iron metals, many other types of cradles where you can handle by the leg, handle by the hand, like that. Many things are available. Okay, so I will take that as modern techniques of cradle. Okay, all the modern cradles. Okay, another one is traditional cradle. Now this is very important. Okay, traditional cradle. Now the one which is made up of this the other materials, synthetic materials, and as well as iron, I will consider as metallic cradle. Okay, another one is traditional cradle. Traditional cradle is the one which is made by the cloth. You might have been observed. Okay, so simply a cloth or sari will be used. Sari will be used, and the sari will be tied into a knot tightly, and then that has been used for the used as a cradle. Okay, now even nowadays, in those days also they used to prepare some of the cradles by using wooden materials, and that is common, wooden materials. Okay, but there is no iron and this metallic material. Wooden materials will be used because wooden material is heat resistant. Okay, and even sometime according to nakshatra they used to prepare different type of bamboo, different type of cradles by different materials. For example, if the child is born in Vrishabha Nakshatra, child was born in Rohini Nakshatra. Okay, I think Rohini Nakshatra is the nakshatra of Krishna. Okay, so therefore Vrishabha Rashi and Rohini Nakshatra, it's like that. So then the Shastra says that the cradle which has to be prepared, that should be by bamboo, because Lord Krishna is fond of bamboos, this flute and all. So therefore such traditions are there. Such different types of traditions are there in the different parts of the body. Okay, so one is made up of iron material or metallic synthetic material. Another one is traditional method where the only cloth is used. Now let us see the difference between these two. The benefits of a traditional dola. Okay, that is the dola where we have tied a cloth. Okay, and especially the sari, long sari, and that has been used as a dola. Okay, now what is the benefit of this compared to the newer methods of newer techniques of this cradle? When you use the sadi, as the dola or doli, then it has got more swinging movement compared to the iron one or synthetic one. Okay, it has got more swinging movement. Now, what is the important swinging movement? Swinging movements to and fro, swinging movements, they are very important for the newborn child. Why? Because child is habituated for the swinging movements. Because in the 9th month of pregnancy, during 9 month of pregnancy, when the mother is breathing, abdominal thoracic breathing, when mother is breathing, every time is abdomen going down, and again it's coming up, isn't it? So now throughout this 9 month, actually baby is habituated for this particular to and fro motion. So that's the reason why baby always sleeps well with the to and fro motion. Okay, so swinging movements are more in this traditional cloth doli compared to the iron or metallic. In the metallic, what happens? There will be more sound, and the swinging movements are restricted actually. Okay, so here you can increase the swinging movement to your extent, whatever you want. Okay, so number one is swinging movements will be more. And number two is when you prepare a doli by a cloth, traditional doli, the baby will be packed from all the sides. See, that's very important. Baby will be packed from all. So when you put on the cloth doli, what happens is the cloth will take the shape of the baby. This is not possible in synthetic, synthetic doli. Okay. Now this doli, the cloth doli, there is no problem when the length of the child is increasing. But if you are using the synthetic doli, what actually happens is, as the length of the baby is increasing, you have to change the doli. You have to change the cradle. That's the biggest problem. But in this, there is no such problems. Okay, 50 centimeter at the time of the birth, and it will be 75 centimeter, or it may be 65, then 70, like that. The length goes on increase by 1 year. By 1 year, it should be, get about 75 centimeter. Okay, so your the metallic cradle may fall short, but there is no such problems in the traditional dolly. Number two. Okay, number three is closed from all the sides. See, it's not possible in the iron dolly. Okay, it is closed, very packed up, packed from all the sides. Okay, from the front, back, sides, and all this. And what actually happens is this particular shape, okay, which a baby gets in a traditional sari dollies, so that is the same position as baby was in the uterus. Okay, in the uterus also baby is almost in the flexed conditions, and if you have to put the baby on the traditional dolly like cloth dollies, baby also get the same flexion positions, and baby enjoys that it is there in the uterus itself. Therefore, it will have a sound sleep. Okay, and sound psych also. It has a comfortable feeling that, oh, I am still in the uterus. Okay, this is another important benefit of traditional dollies. Next, protection from the natural hazards. So as it's covered from all the four sides, it gives a natural protection from the hazards, like maybe strong wind flow, or maybe some of the mosquitoes, and so many other flies and all. Okay, so lights. Okay, any lights. So it will throughout the extent it will block it, isn't it? So it also protects from the natural hazards. Another important thing is it also helps to attain the normal shape of the head. See, when you put the baby on the synthetic cradle, this is the biggest problem. Okay, so when you keep there, what actually happens is head will roll down here and there. Okay, this is not possible in case of, as the babies spend maximum time in sleeping in the infantile period up to 6 months. So if you keep the baby on the iron cradle, what happens is head will roll here and there. Then you have to keep a round takya and all those things, okay, which is made of sand and all. But if you put on the cloth dolly, naturally it will attain a normal shape, and the shape of the head will be normal by itself, because when you put the baby on the cradle, it itself it adjusts for the shape of the head. There is no other efforts required. That's a very important thing. It also helps to maintain the normal shape of the head, because the skull of the baby is very soft in the beginning part. So if you keep the baby only in one direction, then one side may be flat, another side is normal. So usually we will say that frequently you have to change the position. But to come out of all these problems, just simply put the baby on the traditional baby cloth dolly. Every problem will be solved. Okay. Next, this dolly is easy for the cleaning and also washable. This is another important thing. Iron cradle, it's quite difficult. Okay, that's nowadays electrically chargeable. Some of the dollies are also available. They are very dangerous also, and it's very difficult to clean them, because baby frequently passes urine and fecal material and all. Okay, so you have to clean everything. But here the cleaning is very simple. Simply remove the cloth and wash it. That's all. Simply remove the cloth and wash it. So it's easy for portable and washable. If you want to carry it for somewhere else, okay, while you are going on traveling, easy for portability and also for washability. So such a nice method. Okay. Now less noisy when compared to the iron cradle. We know that. Compared to iron cradle may produce some of the crick sounds, but this is less noisy. You can adjust according to the height. Okay. Now coming to this, one more is sari effect. This is something very, very special. Okay, this only Indian philosophy and Ayurveda only explained it. No, none of other science can explain this effect. What do you mean by sari effect? Now, actually, we say that the cloth or sari which has to be used as dolly after birth should be those saris which the mother was wearing during the antenatal periods. It is not that you can use any sari. It is traditionally it is practiced that only those sarees which mother was using during the antenatal period, that sarees should be converted into dolly in the postnatal period, and baby should be nursed there. What is the effect? This is called a sari effect. It's completely a psychological emotional effect, because during 9 months of pregnancy, mother was wearing the sarees, and now baby is habituated for the warmness of that sari. Okay, afterwards, after the birth, when baby was kept on the same sari, again the baby will have a very pleasant effect, comfortable sleep and life. Okay, because it thinks that it's the same, just like uterus. This is called a sari effect. Sari effect. This is emotional and psychological related. You cannot know how it works. I don't know much about it, but it is true. A baby who is nursed on this antenatal saris of the mother, they sleeps very well. And this also gives a sense of satisfaction to the mother also, and also to the baby. Now, these are some of the interesting things. So now some of the precautions should be taken when you are using traditional sari. Yes, number one is sari should be strong enough. Okay. So because and the bolt where you are tying that sari, that should be also very strong. Okay. Number three is you have to adjust according to your height. Adjust according to your height. Preferably on the precautionary method, put some soft material like pillows and all below that particular dolly, so that in case baby accidentally falls, so it will fall over there. Okay, sometime possible, because as the baby grows, it starts with some of the movement, and sometime it may try to start when baby starts sitting after 6 months, 7 months. Baby may sit up in that. Baby may try to sit in that particular dolly, cloth dolly, and there is a time of there is a chance of falling over. So therefore, it's preferably after 5 or 6 months you put any comfortable bed or pillows just below it, so that it will be safe. Then it should be washed. That's very important, because baby passes the urine. See, one more benefit of this traditional dolly is in iron dolly, if the baby passes the urine, it will collect there itself, isn't it? Nowadays we put the diaper, which is not good. But in the traditional sari dolly, what actually means, if the baby passes the urine, it will just fall down. Okay, it fall down and evaporate. See, these are the simple benefits. And at least what happens is baby will not get up. See, when baby is passing the urine, it collects there only. There's a feeling of wetness, and now the babies get up. But here, as the urine directly fall down, okay, very rare chances of baby getting up because of urination. Okay, this is another important thing. But the precautions that you have to take, that also I have told. You have to wash it. You have to wash properly. It should be strong enough. Board should be strong. Height should be adjusted accordingly. Okay, and it should be kept in a very safe area. Okay, so these are the benefits. Now come to the clinical understanding of Dola shayaana samskara. This is everything is over. Now, what is the clinical understanding of Dola shayaana samskara? This procedure, type of cradles, everything is true. Okay, we have explained it. Now we come to, is it this Dola shayaana samskara is only for putting the baby on the cradle, or whether through this samskara the Hindu religious books, they give some message. Yes, they give a very strong message. Point number one, they says that baby should be kept on the cradle or can't transfer to the cradle only after 12th or 13th day. Okay. Now this itself gives a very strong method that baby and mother should not be separated for the first 12 days of the life. Okay. So there is no question of isolation of baby and mother, because they both has to be kept together. Got multiple benefits: maintenance of the temperature. Okay, development of the maternal emotional bonding. Okay, facilitating the breastfeeding. Okay, emotional concern of the mother, comfortability of the baby, many things are there. So simply by explaining this Dola shayaana samskara, the books they mention in religious books, they mention that such a strong message that baby and mother should not be separated. Even it should not be kept in the cradle for the first 12 days. Keep with the mother only. Okay, in touch of the mother, baby will maintain the temperature that act like a kangaroo care. Okay, which is very commonly used. Okay, that's an important message. Ayurveda or Indian philosophy never says that baby and child should be separated. They should be kept together for the first 12 days. Later only they have to be separated. That means transferred to the dolly. Even they refuse to transfer to the dolly also. Even in the government hospitals, private hospital, immediately after the birth, now we will put the baby into the dolly. Isn't it? That iron cradle. They says this should not be done. It should be kept with mother only, in touch with the in touch with the abdomen of the mother. That's one thing. Number two, Dola shayaana samskara gives a clear-cut message of prevention of infections. Yes. See, when my family, suppose a baby is born in my family, then my family is considered as ashuddha for 12 days. Only after getting shuddha, So it is purified, isn't it? That means to a that Ashuddha home, nobody should come. That's the clear-cut message. Okay, in village area, if you see, they will not go. Only after Shuddha they will go. Shuddha means after purification, after 12th day. No, for the first 12 days, all the visitors are prevented. Because visitors are the main thing who bring the infection. You cannot refuse them also. Okay, so that's a very, very nice method, a nice way of refusing them. Otherwise, we cannot even refuse them also, isn't it? So everything is love, concern and all. So to a Ashuddha home, nobody should come. They should come only after Shuddha. First 12 days. That means child is prevented from the risky infection for the first 12 days, and none of the visitors were entertained. Similarly, those who are present in the family should also not go outside, because if they go outside, they can also bring the infection. Okay, so therefore they should not go to the temple, they should not attend any function like this. So message is very, very clear: prevention of all type of infections. Number 2. Okay, so baby should not be separated from the mother. It facilitates the feeding. I explained this. It increases the breast milk secretion and increases the maternal bonding also. Okay, maternal bonding also. Then again, kangaroo methods or maintaining the temperature of the newborn as for Ayurveda. This is a simple kangaroo method. Kangaroo care nowadays we explain. A mother is called as a natural incubator. Okay, so if you have got in the winter season and all, if you have a temperature problem, not able to maintain the temperature, keep the baby with the mother. That's all. Sufficient. Multiple benefits. Okay, so prevention of infection by the visitors. It fulfills the principles of isolation of the baby. Yes, this gives a mother an opportunity to observe the baby and talk with the baby. See, we have to give the opportunity to the mother also. So mother carried that baby for 9 months, and she has got lot of emotional attachment with the baby. And after birth, now she want to talk with her baby. Okay, so if she want to talk with her, communicate with her baby, you have to give a conducive atmosphere there. Isolate mother and child from others. Give them separate room, keep them. Only if required, then attendant will go and give some of the materials. Okay, that's a very good method. So this also gives an opportunity to mother to observe the baby, talk to the baby, and it helps. See, initial first few days are very important to develop the maternal bonding. Okay, child when observes the baby, look at the mother, or listen the sounds produced by the mother. So there are the very crucial things in the development of maternal bonding. Okay, which is nowadays missing. Okay, so this is an observational method. Okay, this also serves as an observational method. Separate them for 1 or 2 weeks, preferably for 14 days. Contemporary science says that it's very important in the early neonatal period, that is 7 days. So we have extended that for a few more days. Okay, so then this provides an occasion to enjoy the happiness, which acts as a stress-releasing occasion to the mother. Now, once the Shuddha is over, purified, then that means baby is out of high-risk period. And now, if the baby has got no problems, by this time what actually happens is breastfeeding is established by 12 days. Okay, mother is also little bit recover from the stress of the delivery. Okay, she also know what are the importance, what are the responsibility, especially in the primary, what is the responsibility of the mother now to feed the baby, take care of the baby and all. And she, by this time, she developed a very good emotional bonding with the child. So this all things helps to increase the breastfeeding also. Okay, so this occasion is just for the enjoying the happiness also, and which act as a stress releasing occasion on the mother. On the 12th day anyway, the old ladies will come multipara. Sushruta also says that in Sutigar also there should be multipara women. The reason is same. They have a lot of experience, because practical experience is more than any other theoretical experience. They have got the practical experience. They have got 5 or 6 deliveries, underwent 5 or 6 deliveries. They know what is actually happening rather than doctor. Okay, so that means what I mean to say is, an unmarried gynecologist or unmarried neonatologist is nowhere stand in front of a old lady who has got 5 to 6 deliveries. She has got tremendous experience. Okay, that works also many times. That also works. Anyway, these are some of the important points regarding the Dola shayaana samskara. Although Ayurveda Samhita has not explained this Dola shayaana samskara, this is one of the very important samskara explained. Dola shayaana samskara. Nowadays also it is practiced. But many of us don't know the scientific importance of that. Okay, so child was already transferred to the cradle before 12th day itself. Again on the 12th day, again we will decorate the cradle and put it. So now there is no sense on it. Okay, actually his child should not be separated from the mother for the first 12 days, and that's the message. And type of doli, that is also very important. Old is always gold, and that's one of the best method. That is one of the best method. You can try it. You can try it. Baby will sleep very well, and growth and development of the child will be also good. So with this, we conclude the Dugdapan Dola Shayana Samskara. Thank you very much for listening. In the next class, we will come up with another samskara. Don't forget to subscribe my channel and also give your valuable comments. Thank you very much.